Welcome back to On Mujib, your trusted source for scientific and clinical health content. In today's episode, we'll be exploring asthma, a chronic inflammatory disorder of the airways. We'll discuss its pathophysiology, risk factors, clinical presentation, triggers, and evidence-based management approaches. If you're a student, health professional, or someone living with asthma, this is for you. Asthma is defined as a chronic inflammatory disease of the airways characterized by variable and reversible airflow obstruction, bronchial hyperresponsiveness, and underlying airway inflammation. This condition leads to episodic symptoms such as wheezing, dyspnea, chest tightness, and coughing, especially at night or early in the morning. The underlying pathophysiology involves the activation of inflammatory cells, including eosinophils, mast cells, and T helper, type 2 lymphocytes, which release cytokines and other mediators. These mediators induce bronchoconstriction, mucus hypersecretion, edema, and airway remodeling over time. This inflammation increases the sensitivity of the airways to various triggers, leading to episodic exacerbation. The etiology of asthma is multifactorial, involving both genetic predisposition and environmental exposures. Common risk factors include family history of asthma or atopy, history of allergic rhinitis, eczema, or food allergies, early childhood respiratory infections, exposure to tobacco smoke or indoor pollutants during infancy, obesity, which may contribute to systemic inflammation and reduced lung compliance, polymorphisms in genes such as IL-4, Illinois, 13, and ADAM33 have been associated with increased asthma susceptibility. Asthma typically presents with recurrent episodes of expiratory wheezing, shortness of breath, dyspnea, chest tightness, persistent or nocturnal coughing. These symptoms may be spontaneous or triggered by allergen, exercise, cold air, infections, or environmental irritants. Physical examination may reveal wheezing on auscultation, prolonged expiratory phase, and accessory muscle use in severe cases. In between attacks, many patients may remain asymptomatic, particularly in well-controlled asthma. Asthma exacerbations can be precipitated by a variety of endogenous and exogenous triggers. These include allergens, dust mites, pollen, pet dander, molds, air pollutants, tobacco smoke, chemical fumes, strong odors, infections, viral upper respiratory tract infections, especially rhinoviruses, exercise-induced bronchoconstriction, particularly in cold or dry conditions, such as occupational exposures such as isocyanates, flour dust, and latex, psychological stress and anxiety. Understanding individual triggers is essential for effective long-term management and prevention of exacerbation. Diagnosis is primarily clinical but supported by objective testing. The gold standard test is spirometry, demonstrating reduced FEV1 FEC ratio 0.75, 0.80 in adults, significant reversibility after bronchodilator, increase in FEV1 12% and 200 ml. Other diagnostic tools include peak expiratory flow monitoring, methacillin challenge test in ambiguous cases, allergy testing to identify specific triggers. It's crucial to differentiate asthma from other respiratory conditions like COPD, vocal cord dysfunction, or cardiac asthma. The cornerstone of asthma management is a stepwise approach as recommended by guidelines such as GINA, Global Initiative for Asthma. It involves both 1. Reliever medication, short-acting, beta-2 agonists, SABAs, like albuterol for acute symptom relief. 2. Controller medications, inhaled corticosteroids, ECS, reduce airway inflammation, long-acting beta agonists, Labazai, used in combination with ICS for moderate to severe asthma, leukotriene receptor antagonists, for example, montelukast, biologic therapies, for example, omalizumab, mepolizumab in severe allergic or eosinophilic asthma. Non-pharmacological interventions include patient education, avoidance of known triggers, vaccination, especially influenza and pneumococcus, and use of personalized asthma action plan. If not adequately managed, asthma can lead to complications such as status asthmaticus, a life-threatening emergency, airway remodeling resulting in fixed airflow limitation, psychosocial issues including anxiety, school/work absenteeism, and reduced quality of life. However, with proper diagnosis and guideline-directed therapy, most individuals with asthma can achieve excellent symptom control and lead full, active lives. In conclusion, asthma is a complex, heterogeneous condition with a well-understood pathophysiology and robust treatment options. Early diagnosis, patient adherence, and evidence-based care are a key to achieving long-term control. Thanks for watching RN Mujib. If you found this content useful, subscribe for more clinical insights every week. Feel free to drop your questions in the comments and stay informed, stay empowered.